together for a number of years. He serves as the medical director also at the Advent Health System for Behavioral Health, providing comprehensive psychiatric services to residents of Winter Park and the surrounding communities. Dr. Allen is a board-certified physician in general and geriatric psychiatry, and he holds academic appointments at Florida State University, Nova Southern University, and St. Matthew's University. Dr. Allen has been in the community now for 23 years. He's a firm believer in community involvement, and he serves on the board of directors for the Alzheimer and Dementia Resource Center. He is a Maturing Minds Advisory Committee member, and he volunteers at the Shepherd's Hope, a non-denominational healthcare organization. Dr. Allen holds additional training in ECT and TMS, and that are both used for depression options. It's a pleasure, Dr. Allen, for me to introduce you and welcome you to present today. You're going to really enjoy him, and I'm going to turn it over to you now.
Oh. Thank you very much. I really appreciate the invitation from Central Florida Behavioral Hospital to do this presentation. I'm a strong believer in community effort, in particular with mental health, because that's the only way that we are going to make an impact and make a change to this area that is, as always, in so much need. So what we're reviewing today, and it's going to be an overview that we're looking at mental health survival guide in this current COVID-19 pandemic for seniors and their families. And I think it goes without saying, a lot has changed in the past few weeks. Now, we first were counting 1 month, 2 months, and now we are 15 weeks and beyond. So it's our lives have changed, and our lives of our patients have changed. Our life at work has changed, and let us kind of review some of these changes. And we're trying to make this as interactive as possible, even though, again, this is a change of how we're doing it now, our presentation. So if we can get some feedback from you, it's we really appreciate it. And I have 1 or 2 items there that are questions that I have, and getting your feedback will be very important. So let me go to the first slide. Is that I think it goes without saying that throughout this period of time, there has been a lot of information and misinformation. And the goal of our talk today is to be able to provide you with those tools of accurate information, because so much is said out there. And how do we sometimes filter some of this information? And a lot has evolved over the past few months. If we look at the beginning, what was being said, what was being done, to what we're doing now, it's different. But we want to make sure that our senior population, which we consider to be one of the most vulnerable one during this period of time, and if we remove this current event, our seniors population have always been vulnerable, but yet now with this, it has put them in a special category, and we'll look to see what are some of the reasons why they are at risk. So the next slide is actually one that I said, well, you could use your chat. Could use your chat to give us a response. There is a number there, a telephone number that you can utilize to send us a text. And my first question is that how the world has changed. And let me kind of take the easy ones from you, and then if you can decide on the others, I'll give you 30 seconds. I'm doing the easy ones in terms of where we never thought that in our place of employment, when we are checking in, someone would be checking our temperature. Needless to say, now we're wearing masks. The top left corner one with the hand washing, it doesn't mean that we were not washing our hands before, but clearly the number of times that we're washing our hands has significantly increased. And some of you probably have experienced now the being at home and being in that role of educator. So all of this is just in the past 15 weeks, all of this have changed for us. So I will pause for just a few seconds. If you can send a text or give us some of the other items that you have noticed how the world has changed.
If anybody has any questions, you can either text the number that Dr. Allen provided before over here, or you can use the chat function or the Q&A function, which we're monitoring as well.
Yes, those are, yes, the wearing of the mask, the social distancing, going out, the gathering, and, you know, even this meeting that we're having. So yes, everyone have noticed how things have been changing. I not been able to see friends and family as much or easily. I'm reading some of the other replies. Increase in substance use. We run from others now in stores. That is true. Lots of isolation, unknown fears that and we have fears about new opportunities. There has been changes with family dynamics and children behavior, schooling, and oops. And someone wrote, we seem to be in a mass traumatic event. And yes, this is so true. The increase in isolation, unemployment, food. Oops. Food instability and dramatic increase in anxiety. And we'll be talking about that. And so we have need and isolation. I'm seeing another that says isolation. So the list is really long. A lot has changed for each one of us. And that's the reason why today, when we're doing this presentation, we need to think about our patients, our healthcare workers. And with that, I will include us. We are the healthcare workers. And then the next one is what we're doing for our community. But there is one of the quote from the World Health Organization that I've always kept very close to me, and it's the one that they said, there is no health without mental health. And that is so true. At times we are looking at so many important aspects. And even now, that's one of the things that we are hearing so much of the virus, how it's important to wash your hand, wear a mask, the social distancing. And we're not hearing too much and about how to protect our mental health. And this is something that we need to consider for our patients, for ourselves, and our community. So always we think of those three areas. And in that, going along with that overview, what we're going to look is kind of general mental health and the COVID-19. I want to talk about healthcare professionals since we are at the forefront. And if we are not taking care of ourselves, it will be very difficult for us to take this message out and care for our seniors. And our life really should be an example. And then the last aspect I'll talk about is the seniors and why this population is so unique. We have not dealt with here, at least in our lifetime, with an illness, a disease that has a psychological impact of a novel and potential fatal illness. That's the part that becomes very challenging. We know that this is something that potentially could be fatal, and yet it's kind of pretty much everywhere. And how to stay safe from it, that is one of the factors that also add to our anxiety. The other is the anxiety about infecting others. And then the third aspect is that stigma if infected, how to deal with that. So this current crisis has several dynamics that we're dealing with that makes it very unique and challenging from a mental health aspect. This is before this event, before COVID, just to keep in mind that 1 in 5 adults experienced some form of mental illness. 71% experienced symptoms of stress, headache, overwhelm, anxiety, and we know by living in society can be very challenging. It's very important for us to know of ways, healthy ways of how to cope. And clearly that needs to be transmitted and shared with our patients. So I often get asked the question regarding what has, from mental health aspect, what are we seeing as the change in terms of with psychiatric diagnosis during this crisis? And there are two. It's the anxiety disorders, and we'll talk about that later. There is no question that we haven't seen an increase in the anxiety disorders type symptoms, and more extreme panic disorders are coming to emergency room in our community. And then the other is the increase in substance use, and the increase in substance use primarily is alcohol, and we'll talk about that also later when we're talking about the area with us seniors. So what's the impact in behavioral health is, yes, we have seen an increase in anxiety disorder and the alcohol consumption, and sometimes it's an attempt at self-medicating. These numbers that we're seeing here we know that the epicenter of where it started was in China, in Wuhan, China, and they were the ones that put out the first initial studies of what they were seeing in terms of the impact in their community. I think over the next few months, we'll start to understand more of what is happening in a more systematic way, more evidence-based manner. But at this in our country, but at this time, because everything is so new, data is just being gathered, and there is a lot that we're still learning. But these were some of the numbers that they were seeing at the beginning, that 52% of frontline healthcare workers were more likely to have symptoms of depression. The second was 57% were more likely to have symptoms of anxiety. As we said before, anxiety is at the top of the list. And 60% experienced some level of distress and there was a 3 times more likely of individuals having disruption in their sleeping patterns. And we know how important sleep is in mental health, because that's when it's the period of restoration. And when we don't get enough of it, or we are not getting good quality of sleep, it impacts and other aspects of our day-to-day function and our mental health function. So how does this affect? We said initially we'll talk about the the changes in general. Then we'll talk about the healthcare worker, because we are the ones providing the care for our seniors. And the last portion we'll talk about our seniors. So with the healthcare worker, it does impact on their productivity. If someone is having symptoms of anxiety, they're not sleeping that well, there can be a lack of engagement. There's a lack of quality interaction with the co-workers. And of course, there's more fatigue, more decrease in that physical capability. So we said it's very important as healthcare workers, and you'll see that I'm repeating this over and over again, that we take good care of ourselves, because we are the ones that are going to protect and help our seniors. So the first is to recognize that none of us are immune to this. And that is something that we need to keep in mind. We are not immune. We are all in this, as you have heard so many times, we're all in this together. So therefore we are at risk, and it's not for you to be scared, but just to make sure that we are very mindful of the symptoms, and for us to make the proper intervention. Understanding that this will be a temporary, and it's when you're in the moment, it seems like eternity, but even this will be a temporary, and things will get better. But we have to keep that perspective in mind. If we are experiencing any symptoms, not to let symptoms linger, not to try to rationalize them, but early intervention is important. And the fourth aspect, I'm sure for some of you might be surprised, but it's very important that if there is someone in the household that is experiencing these symptoms, we don't, and in particular in the household, we don't live in silos. So if there is someone in the household that is experiencing symptoms, it is important that you assist this person in getting help, because this can also affect our own mental health well-being. And the last is seeking those outlets, healthy outlets, like the exercise, regular sleep, and balanced diet. When we look at the aspect of exercise, I know even that has changed, because not all our gyms are available. So we have had to become very creative in the things that we do. I think there probably has been an increase in the number of people on hiking trails. So there are other ways that we have to look to see how we can bring this cardiovascular activity, because it's not only help us physically, but it also help our mind. And the sleep, I consider to be such an important aspect, that we have to make sure that we are getting regular sleeping time, and the right amount. So it's not only the quality, but the quantity of sleep is very important. So now we are coming to our seniors now. So it's very important to have some guiding principle for our seniors as we interact with them, keeping in mind that with seniors, as we age, there are different changes that are happening. And let us kind of roll back the tape to before March, and let us talk about aging in general, that it was a challenge to deal with some of the aspects at times as someone is aging, and there are changes in hearing, vision, mobility, increased risk of falls. There also issues as it relates to the development of certain psychiatric conditions. So all of these things were a challenge before COVID. Now with COVID, it has accentuated some of this even more. But then there is another aspect that happened with the senior population, and it is that this current crisis and this virus affects the senior population is at higher risk. So here they are dealing every day in their mind, be it conscious or unconscious, with the fact that when they are interacting out there, or they're going to the supermarket to get some groceries, or for that matter, going to the pharmacy, or some still need to make it to the doctor, is that they are considering that there is something out there potentially that could kill me. And this is something that if they are thinking about this day in, day out, you can imagine how this will take an emotional toll on the individual, and in particular with our seniors. So let us go back to those guiding principles. Social connectedness with seniors is essential. They are the group that also at risk of having social isolation before COVID. And the reason is that there is changes in the social structure, death of a spouse, death of friends, other support system. So it's very important that we look at that social connectedness with seniors now, given that we are now adding to this social distancing and isolation. It is very important that if there are seniors that in the home that we are interacting with, or for that matter, that are close to us, as we're making decisions, to keep them involved in the decision making at the family level. Even though, yes, we're not seeing them as much as before, make sure that we are not just isolating them, and that we are making decisions without their input. They welcome it, they enjoy in terms of being part of that extended family. Clearly, I would like you to go through this exercise right now, that if you think of any senior that you know that is that lives alone, think about it. I'll pause just for 5 seconds. If you know of any senior that lives alone, this person needs in this current crisis needs special attention. So think about reaching out to this person, be it by phone, text, in some way to make some contact with them. It is very important that those that are living alone before this crisis, that we know that they are in terms of at risk of dealing with very significant mental health aspects. And as much as it is important to provide that reassurance, my next point, it says doubt needs to be addressed periodically. And why do I use the word periodically? Because we don't want to be talking about this all the time, but it's important to provide some level of reassurance is important for it not to be totally ignored. It's not going away. So it is important that any anxieties or fears about it, for there to be discussion about it, and provide to those seniors that reassurance that they are looking for. So the other, and we talk about misinformation in the beginning, that it's one of the aspects that can add and create anxiety. It's very important that the digital time need to be limited to prevent misinformation. If we're constantly, and for our seniors, this is the advice that we will give them. If they're constantly watching the TV, or for that matter, reading newspaper, going online, have text notification regarding what's happening out there with this current crisis, they will at some point receive misinformation, and which will then lead to panic. And it's very important then to be able to limit. It's important to be informed, but limit that digital screen time. The second is that it's very important to direct our seniors to have one credible source of obtaining that information. If we are getting that information, if they're getting it from different sources, it can really become overwhelming. And with some of my patients, I have gone to the point of just saying once a day, only once a day to get the information. At this point, it's more than enough. I know in the beginning there was so much happening, but if they can limit this to once a day, it probably will help with their mental health. There are a group of seniors that we need to pay very close attention. And I guess for that matter, if we are dealing in mental health, those with pre-existing condition, and I mentioned here dementia, depression, and anxiety disorder, we need to have a high sensitivity for these patients, because they are at risk of either worsening their primary psychiatric condition, or sometimes developing additional symptoms or additional psychiatric condition. One of the prediction, and again, the idea is not for us to be scared, but is to be well informed, is that the expectation that in the post-month that we will see a surge in mental health issues, that as time go by and things are continuing to, in fact, improve, that we will continue to deal with the mental health aspect. So for us that are in mental health, we need to be aware of this, that even there will be a flattening and there will be a decreasing of the curve as it relates to the virus and the rate of infection and spreading. But our job, our task as mental health workers, it will not be over. It will continue to be there, and sometimes even rising. And we have to be very mindful of this in order to make the proper intervention with our patients. As I mentioned before, that there were two of the areas that we have noticed an increase, and that's in anxiety. And with our seniors, keep in mind, I put there, anxiety in seniors can be contagious. And have you ever been close to an anxious person? You notice that after a while, you start to experience some of those symptoms. So it is very important that if one of our seniors are experiencing symptoms of anxiety, for there to have the proper intervention to try to help with decrease that anxiety. But for that, goes to the second item that I have there. It's very important for us to understand and anxiety. What are the different type of anxiety disorders that our patients can experience in order to make sure that we are making the proper intervention. What are some of the symptoms? And this to some degree is a summary of some of the items that I mentioned before, but with our seniors, it's very important that we look in terms of at what are some of the underlying symptoms that someone can have, that before it becomes a full-blown problem, that we need to send the raise our awareness or alarm. And one is if we start to notice that they are having changes in sleeping habit, initial insomnia, middle insomnia, or early morning awakening. If we are noticed with our seniors that there are changes with their mood, if there are changes with mood, clearly we need to respond to that and make some changes. If we're realizing that cannot get motivated, they used to be able to read the newspaper. In the past, they will go out for walks, and I know the senior center might be closed. They used to enjoy doing that. They're not doing it now. And they notice that they just cannot get themselves motivated. Then we need to be able to respond to that also. And some of it is working in very concrete way of looking at what other alternative they have, a very customized day-to-day plan for them that they can have, an alternative that probably they were not even thinking about, but by sitting down with their healthcare provider, having that one-to-one, they can come up with a great idea. So we are all definitely instrument of change, and we are the ones that will be able to help our senior population. The increase in anxiety, and that's we saw that in the previous slide. And if there are changes in eating habits, either increase or decrease, we often see more in the decrease in appetite. Then it's very important for us to realize that could be one of the early signs of underlying mental health issues. And the increase in the desire for alcohol consumption to feel normal. And I cannot underscore this because I have noticed that because of the increase in the alcohol consumption, I do a lot of work with in emergency room doing the assessment. During this period of time, there has been an increase, so then which lead to other aspects, and we all know alcohol is a depressant. With that, it disinhibits. So if someone before this was having some episodes of depression, not that significant, but now the alcohol consumption has increased. Now, because of that, it leads to that sense of helplessness, hopelessness, and you know where I'm heading with this. So we're seeing now, because of that, now they are because of being disinhibited, making suicide attempts or verbalizing more suicidal thoughts. And this all started, if we go back to the increase in the alcohol consumption. So it's very important for us to advise them about it. Now, the other aspect is and clearly now with the numbers increasing, I described that before in March here in Florida, we were kind of more spectators. So we were seeing what was happening in other parts of the country. Now we are part of it now. So at some point, I'm sure that you know someone who tested COVID positive. You know someone who are probably experiencing symptoms, and what to do if we know someone who is COVID positive. I have heard that do not make physical distance and isolation become emotional distance and withdrawal. And that is very important for us to keep in mind. Do not withdraw from the patient, from the individual. They are, yes, very important steps that we need to take, but try to, in as much as possible, keep those non-physical contact increase. And what does that mean? Is that there, if before you were speaking with this person once or twice a week, probably now would be a good idea to make daily contact. And if you're speaking with a person once a day, maybe now this is the time for twice a day, because in this individual world, there is a lot that is going through their mind, keeping in mind that the same fears that we mentioned early on of having something that could potentially, the risk is at times is low, but just the fleeting thought of something potentially fatal within you, it kind of, it wears on the individual. So it's very important that as the individual is struggling with this, for us not to use that time now to withdraw and not be interactive with them. And the last aspect that I mentioned there, if you know someone with COVID, be creative in how you reach out. You know the individual, you know what their needs are. So just be creative in how you keep that connection. There is physical distance, but how we make sure that we don't create that emotional distance and withdrawal. So for our seniors, I included here the quick tips, which it's very important that as we interact, as we develop plan of care for our senior patients, that we provide these 5 items for them in terms of trying to establish, because the world have turned upside down for them, for us, for everyone. Establish now a structured routine, and you're hoping that at this moment that there is a routine already established. But if not, then let us help our seniors to develop that structure routine. Remain cognitively active. Still, if it's a crossword puzzle, Sudoku, you name it, whatever gets their interest. Sometimes just in conversations that you're having with them of areas of interest. I know there is not much going on in the sport world, but maybe it's time to reminisce about sports. Whatever it takes to keep those mental juices flowing, and make sure that we are keeping them mentally active. We mentioned already the aspect of exercise, where exercise, it's not only important from a physical standpoint, but exercise is also important from a mental health standpoint. I've said it so many times, but I hope this is part of the take-home message. It's important for us to tell them to avoid the use of alcohol to try to treat anxiety. And I've heard some that have said they are using it because they're feeling anxious or there is nothing more to do. So to try to avoid it for anxiety or boredom. And then it's very important that each one of us be familiar with our community resources that can help during this period of time, and be able to share that with our patients. Okay. And I really would like to close with this quote that says that the need is so great, but before we can address the need, there must be an awareness. And I really would like to invite each one of you to join us on this journey of how in our community we can increase the awareness, because we know it's there and we know that there are needs out there, but because the awareness is not there, they're not seeking that help or treatment. So we need to help, and we all need to be participant in that journey of increasing the awareness of our mental health aspects in our community. And with that, I will close. I know I've said a lot. I hope I didn't put anyone to sleep, but it's a lot of information that we want to make sure that we convey and that you share with your seniors as you interact with them. Thank you.
Thank you, Dr. Allen, for that awesome presentation, incredibly timely, as we know. Such a population that's just really not talked about, I think. So thank you so much for sharing this. And everybody who's on this webinar, please feel free to go ahead and share this recording as well, which will be on our website, with others who were not able to make it or who may benefit from watching the webinar. Also, I would ask, if you'd like to be aware of our future trainings, we do trainings at least once a month. You can go ahead and follow and like our Facebook page and our LinkedIn, and that way you'll always know future trainings that are coming up. We also have a CEU that's going to be coming up on the 31st of July. That is on the topic of perfectionism during the pandemic and how that can become fatal and life-threatening. So that was with Dwight Bain. That's going to be again on July 31st. At 9 a.m. That's a 1-hour CE presentation, and flyers will be sent out next week with registration links. And with that, we'll go ahead and close and say thank you. Thank you, everybody, for taking the time to participate. And we hope you bring this message back to others to benefit them. So thank you again. Everybody have a happy Friday and a very, very nice weekend.